Stand by for broadcast.
You're listening to Inside Air, a behind-the-wire view of the Royal Air Force, its people, technology and operations.
Hi, I'm Flight Lieutenant Chris Solly, and welcome to the final RAF Inside Air podcast of 2025. We're off to High Wycombe to meet some of the brilliant team from RAF Medical Services. We'll be hearing more about the worlds of the paramedics, the allied health professions and nursing, how they help us achieve what we're here to do, and the opportunities each offers to you if you're thinking of a career in the field.
Within the NHS, this is now common practice, and we are building our practice in line with the NHS so that we offer that high-class expert service wherever you are in the world.
Most importantly, it's morale. It's morale for the individuals on the ground, knowing that if they are injured or ill, they are going to get the most comprehensive treatment possible by the individuals they're supported with. And I'm very proud to say that each and every one of the paramedics we've got has that desire to provide the top-class patient care which they deserve.
The experiences that I have had since being in the RAF, second to none. And when I see our aircraft flying overhead, I am so proud. This morning, literally on my way to work, we had a Chinook fly over High Wycombe, and it's just reminding us that we're part of something that delivers to the effect that we deliver, and it is per order ad astra, through adversity to the stars.
As usual, we'll also reheat a few stories which might have slipped under your radar, and we'll be finding out who's under the hat this time with AS1 Ben Russell.
What's the best thing about your job?
Leading our talented reservists, seeing them thrive and achieve more than they thought possible is genuinely rewarding.
You're listening to Inside Air. In this episode, we're going to be looking at the medical services within the RAF. A bit later on, we're talking about RAF paramedics and also allied health professionals. But to get us going today, the Nursing Professions Advisor for Enlisted Aviators is Warrant Officer Laura Gardner, who's at High Wycombe and who joined us now. Laura, welcome to Inside Air. I'm going to ask you first of all, when we talk about nursing generally, what do we mean?
Okay, so Chris, nursing is really a dynamic profession, and actually the Royal College of Nursing does a really good definition of what nursing actually is. So nursing is a safety critical profession, and is founded on 4 pillars: clinical practice, education, research and leadership. And to be a registered nurse, you've got to use evidence-based practice with your professional and clinical judgment to assess, plan and implement that real personal centred nursing care. So it's a very dynamic profession.
How much of it is focused on the patient? How much of it is focused on the administrative side? Or is it a combination of all of those things and obviously ongoing training?
It's all those things, but to be able to deliver effective care, you need to really be able to have those 4 pillars. So you've got excellent clinical practice, you have the education knowledge that goes behind it, you undertake research so you understand why you're doing things, as well as that clinical leadership so that you absolutely bring that best care for your patient.
That's nursing generally. If we now sort of bring that down and look at nursing within the Royal Air Force, are there any significant differences? How does it tie in with the career generally?
So nursing in the Royal Air Force is, the first thing I can say is that it's just such a great career. Nursing within the Royal Air Force is all about providing that medical care to our service. So we need to be able to deliver care both at home and overseas. So we need to have specialist nursing skills, and in the Air Force we need to care both in the air and in deployed locations. To do that, we need to work clinically and undertake placements in those best areas for the skills that we need to have when we go away. Clinical placements at the moment are actually in the NHS. We work in ambulance services, Defence Primary Healthcare, Stamford Hall, and we have both mental health and adult nurses. So if you went to the emergency department in the John Radcliffe at Oxford, you went to Frimley Park Hospital, or you went to QE2 in Birmingham, you would also run into RAF nurses. We also at more specialist hospitals. If you went to the Queen Victoria in East Grinstead, this is actually a highly dedicated specialist centre for reconstruction surgery. And this provides really high quality placements for our burns and plastics nurses. And I don't know if you know, but the Air Force has a really rich history with the Queen Victoria Hospital. So Archie McIndoe was an acclaimed surgeon there, and they actually took reconstructive surgery on Allied aircrew following significant burns in World War II.
Is this the
And
guinea
you
pig
call
club
them-
that we hear of sometimes?
Yeah, absolutely. They are the guinea pig club. If you go to the Queen Victoria, it's incredible to see our shared history. As you walk down there, an original Nightingale Hospital and RAF memorabilia on the wards.
What does it bring to your team when they go and integrate in those placements? You talked about the placements. It sounds great. What does it give that person who goes and does that as far as the RAF is concerned?
So the RAF needs to gain those clinical skills, and we need to go to the places where the patients are, and get those specialist skills working within the NHS as a partnership. So we bring our military knowledge to them, and they share their experiences with us, and it is a really good collegiate working relationship.
And presumably working in a really busy NHS setting gives your team, your nursing staff, a real sort of hands-on day-to-day experience of that.
Yeah, so we need to get those clinical skills, and working in the NHS is where those skills are within the UK. So we absolutely need to go and work in the areas where we're going to be exposed to the clinical conditions, so that when we go abroad, we have the skill set that we need.
And of course, the medical side of things, nursing and the whole support system that goes, we're chatting later, as I say, about paramedics and other things, fits into that big picture of the care and the provision that we make sure we look after our people. They're ready to fly and fight.
Yes, definitely. And nursing is one of the moral components of the Air Force, where we absolutely will make sure that we go and get our people wherever they are in the world, and we provide a 24-hour service. Wherever you are, we will come and get you.
And what does it mean to you personally to be a nurse within the Royal Air Force?
So I've had an incredible career in the Royal Air Force, and done some amazing things. So within the Air Force, I'm a primary healthcare specialist nurse. So I've completed many civilian recognised courses, including non-medical prescribing, and then built on this knowledge and become a nurse educator. So I would say that the RAF actively encourages nurses to develop themselves so we can deliver the best care that we absolutely can. Within nursing at the moment, in the RAF, you can specialise in infection control, medicine, surgery, and many aspects of acute care. Whilst in mental health, our nurses can take courses giving them additional therapies, which really will optimise those patients' outcomes.
Laura, one of the things I've heard bandied around, and the military love acronyms and three-letter abbreviations, ACP in terms of nursing. What the heck does that mean?
Right. ACPs is Advanced Clinical Practitioner. And actually, within the RAF, you could come in as a student nurse, undertake specialised training, particularly at the moment in emergency nursing, and then you can go on to do advanced clinical practice and become an ACP. ACPs are not just nurses, but they can be any registered healthcare professional, and they will provide that clinical leadership and high quality care. This is a demanding 3-year programme where you'll undertake a rigorous assessment process, and by the end of it you will actually be credentialed with the Royal College of Emergency Medicine, which is a nationally recognised standard of competency. So in the RAF, this is nurses working at the top of their scope of their practice with a high degree of autonomy and trained to make complex decisions. This will provide resilience within our capabilities, because they are able to make rapid assessments, start those life-saving treatments, to rapid diagnosis and consider alternative diagnoses as well. And they're going to be experts in resuscitation. So when you think about deployments, look at the scope that an ACP will bring to that deployment. So they are amazing assets within our service.
How unique is that within the nursing profession?
So within the NHS, this is now common practice, and we are building our practice in line with the NHS so that we offer that high-class expert service wherever you are in the world.
And Laura, sort of looking at the other end of the career, obviously, as people come out, one of the things people are always thinking about is, what do I do when I leave? Presumably, all of these qualifications you're obtaining during your career within RAF nursing are transferable beyond life in the RAF.
Absolutely. So our nurses are highly qualified. When they come out of the service, we are highly employable and attractive to any healthcare provider with the skills that we have and the leadership that the RAF have provided us throughout our career.
For somebody who's listening to this, maybe already in nursing or thinking of going into the profession, what are the advantages of doing it via the Royal Air Force?
So for me, the advantages of coming into the Royal Air Force to do nursing is the ability to work in a variety of places, to gain those clinical skills, to be invested in. So the Air Force really invests into your clinical practice and makes you become an excellent nurse. There's opportunities to undertake research. We have clinical fellow opportunities. Within research, that there are so many opportunities within nursing within the RAF.
And you're looking for people right across the board. So we're talking about people maybe who are already in the profession, or people who are maybe still at school, at university, thinking about going into nursing. Are there opportunities for everyone?
There is so many routes into nursing within the RAF. At the moment, there is a worldwide shortage of healthcare workers, and the RAF is not immune to this issue. So we need to attract nurses at all stages in their career. So we offer student nursing for adult nurses, and that really enriches our workforce. We also offer this opportunity to serving members currently in the RAF, so you can remuster and join our profession, as well as direct entrant nursing students. Our student nurses currently train at Birmingham City University, and they will do a 3-year degree programme which will enable them to register with the NMC. I think this is a really incredible opportunity to gain your nursing degree while receiving a full salary and all the benefits of the service without the burden of tuition fees.
And that's such a big thing these days, because people leave university with big sort of financial burdens. This is an opportunity to do it in a totally different way. If somebody is interested, maybe now, you talked about remustering, we talked about people coming into the profession, fresh into the profession. What's the best way to find out more? What's the best sort of first step people can take?
So we have our own recruitment team, so a specialist recruitment team for nurses. And if you were to Google nursing recruitment RAF, you would come in contact with our team and they would be able to advise you on those next steps. And we currently have student nurses every year. We have a nursing recruitment team, and we have opportunities at the moment every year within nursing for student nurses. And if you contacted them, they would be able to advise you on the next steps.
So plenty of ways of doing it. If I could sort of just finally to ask you, summing up in a few words, what is it that you love about the job of working within the nursing profession in the RAF?
For me, it's about the diversity of my career within the RAF. I've been able to work on Aeromed. I've gone and worked in rehab. I've gone and worked clinically. I've worked abroad in TPMH. For me, it's the diversity.
Fabulous stuff. Laura, thank you for taking the time to talk to us, and thank you for being here with us on Inside Air.
Thank you.
Let's move the story along now, but we'll stay in High Wycombe, where the SO3 for Allied Health Professions within the RAF is Flight Lieutenant Shai St. Bryce, who works within the AHP world. What does that mean? Allied Health Professional. Shai joins us now. Shai, when we talk about AHP, Allied Health Professions, what are we talking about exactly?
We're talking about other specializations within the medical field that are not doctors or nurses. So we have within the RAF Medical Services 6, and there are environmental health practitioners, operating department practitioners, dental nurses, radiographers, pharmacy technicians, and biomedical scientists. So those are the 6 allied health professions that we have serving within the RAF Medical Service.
And in terms of how AHP fits into the wider picture within health services, how does it work?
So we have our NHS facing specialization. So these are individuals that work within the NHS environment. So that's our biomedical scientists, or radiographers, and our operating department practitioners. So they work alongside quite closely with their NHS colleagues within the NHS hospital environment. And then we have our defence-facing allied health professions, and they are our pharmacy technicians, environmental health practitioners, and dental nurses. So they're the individuals that you'll come across if you are on station looking after our force health.
When we look at the bigger picture of how AHP fits into the service that's provided, it's very much in support of the front line. We're looking at those things you're talking about, radiographers and those things. They fit in that supportive role, I guess.
Yes, they do. They're quite integral to the medical team. They form part of the multidisciplinary team, particularly in the secondary healthcare states. So when we've had OPERIC in the past, they would be working in our Role 3 in Camp Bastion, supporting the doctors and the nurses with the patients admitted there. In regards to the homeland, we have our pharmacy technicians and environmental health and dental nurse, ensuring that our forces are fit to deploy in support of defence tasks, both overseas and in the UK.
And that's a really important message to have, isn't it? Because we can look at the frontline stuff, but obviously if things like your teeth aren't in great order and you're going to be deployed off, whether it's an exercise or an operation, that's going to have a knock-on effect in the directive to fly and fight.
Absolutely. We ensure with the dental nurses and the pharmacy technician working within the primary healthcare environment, so be it the dental centre or the medical centre, we ensure that our troops are fit to fly and fight.
So that's life within the RAF. When we look at that, and you touched on this a moment ago with the NHS, how does it work within the wider community for you?
Okay, so we engage with recruitment fairs, if that's what you were referring to. So we go out to university fairs to let individuals know what opportunities are available within the Royal Air Force Medical Services in regards to supporting MACA tasks, that's military assistance to civilian authorities. We were part of Op Rescript and Op Broadshire, and that was supporting the NHS with the COVID vaccinations and COVID testing. So we, in terms of recruitment, engaging with the new individuals coming through, individuals that are interested, and in terms of supporting or homeland defence and supporting or civilian authorities to ensure that we offer them that resilience.
You mentioned things like military aid to civilian authorities, MACA, all of those things, right the way through from those things through to frontline operations. The one thing that's going to be sure when it comes down to it is that the medical teams are going to be involved in some way, shape or form, aren't they?
Absolutely. We're always there to support our NHS colleagues in terms of in operations. You've seen a few. We've seen Op Greenlighter. One thing we do have on readiness is Op Ventus, and that's support to the Caribbean. And we've seen that recently, haven't we, with Hurricane Melissa hitting the Caribbean islands. So we do have that enduring capability that is stood up around the hurricane seasons within the Caribbean to send out, aid for disaster relief.
And for you as an individual working as part of a wider team, it must be a really rewarding thing to see something come and land on your desk on, I don't know, a Wednesday afternoon or whatever, and then see that through to the final execution of the exercise or the operation, whatever it might be.
Absolutely. So when we look in terms of pitting that the notice to effect and getting our Role 1 medical capability out the door and getting our people spun up to support and to see what we were able to achieve in such a short space of time at a time that was, quite significant for the Afghan individuals. It's something to stand in awe of what our people can do to deliver in support of other nations.
And for you as an individual working as part of that team, what have been the particular highlights of the last few years?
So I had the good luck, I would say, to work quite closely with the Kuwait embassy the British Embassy in Kuwait and working with the British ambassador at the time to roll out our COVID vaccination to our personnel stationed there on deployment and also permanent postings. So working with with those individuals quite closely and learning Arabic. So it's the opportunities that you would not have in a civilian role that is worth celebrating being part of the RAF Medical Services.
And you touched on that, sort of the civilian side with the RAF side. If somebody's listening to this at the moment and thinking about a career in one of the allied health professions, what are the advantages of taking up an offer with the Royal Air Force as opposed to sort of self-funding and going through the training yourself?
As you've just said, Chris, it's a self-funding. You're not leaving university with a debt. And not only are you not leaving with a debt, you're also being paid to train. So we will train you to undertake your Bachelor's of Science, and it depends on the specialization you're going into. But for most of our specializations, you do get trained to a degree level, and you will not be paying for that. You will be paid, accommodated, and fed throughout your time at university. And that is something worth celebrating, as you're not leaving with university with debt. You are going straight into a role where you will be delivering against national defense task, as well as earning and we pay pretty well, if I would like to put that in, when we look at comparative pay, as well as the fringe benefits. And I say fringe benefits of being in the service. If you are married, you get, or in a civilian partnership, you do have subsidized housing, we have medical, we have dental. There is quite a lot to the offer joining the RAF.
And of course, when we're at this time of year, for people frontline NHS, it's full on, every day is the same. I'm guessing it might be different in the RAF?
Yes, it is. During the Christmas period, unless you're on essential duty, you do get 2 weeks of stand down. So when we look at what we are allocated in terms of annual leave comparative to our civilian counterparts, it's quite substantial. It's 38 working days, and that when you span that over a couple of weeks, you do get enough time to achieve that work-life balance, which is quite critical for everyone, work-life balance with your family.
And throw into that the camaraderie and also things like adventurous training when you get the opportunity to do those things.
Absolutely. We have had someone within the operating department practitioner return from an AT exercise recently. And again, it allows you to travel the world and take part in the sport that you enjoy. And so that is something that is another kind of feather in the cap of being in the military.
So again, for somebody thinking about a career in allied health professions, the RAF sounds like a really good opportunity and a really good way to go about that. What's a good way for somebody to find out a bit more if they're interested?
So we do have the RAF World events, and I would invite individuals to come in. You get to speak to me and other people, other personnel within the medical professions. If not, you can go on to the RAF careers page, and you can find out more that way and reach out to our virtual AVCO. And I look forward to you joining one of my specializations.
Shai, I do get the impression that this is a career and a sort of vocation that you really enjoy working within the RAF.
Absolutely. The experiences that I have had since being in the RAF is second to none. And when I see our aircraft flying overhead, I am so proud. This morning, literally on my way to work, we had a Chinook fly over High Wycombe, and it's just reminding us that we're part of something that delivers to the effect that we deliver, and it is per order ad astra, through adversity to the stars.
Fantastic. I don't think we could have said it fairer than that. Shai, thank you for taking the time to talk to us this afternoon.
No worries, Chris. Thank you for having me.
So moving the conversation along here on Inside Air, Warrant Officer Jake Callender is an RAF paramedic, Professions Specialist Advisor, or PSA. Jake joins me now.
Hi Chris, and good morning. Thank you for having me. I'd like to start by making it clear to the listeners and for overall awareness that the RAF paramedic is proudly and currently a subspecialisation within the RAF Medic Clinical Employment Group, which we have then undergone additional training and a degree level education to become registered paramedics recognised with the Healthcare and Professions Council.
PSA, what does it actually mean, Jake?
It's a role which is established to create the direction and to guide the RAF paramedic specialisation, to ensure the governance and the structure and our dynamic support to our service persons is ensured. I work part of the larger team within the Health Directorate to ensure that the career pathway is managed appropriately for all of our service personnel and, more importantly, the paramedics within that speciality.
When we talk about paramedics, what exactly are we talking about within the medical field?
So what you're going to get from an RAF paramedic is exactly the same as what you would get as an NHS paramedic. We hold the same registration. We are all qualified with the Healthcare and Professions Council, and we have multiple ways of undertaking that. But the main one for us is qualification of RAF medics through to the paramedic through a university degree pathway, which is now 2 years at university, followed by a newly qualified paramedic phase. For the need of the paramedic, it's all based around operations, the operational care pathway to support our patients, delivering that autonomous, unscheduled pre-hospital emergency care experience for our patients to ensure they get the best care possible.
So, Jake, you've gone through the process. What's the main difference between being an RAF medic and being an RAF paramedic? What are the advantages? What does it bring to your career?
So I'm going to break this down into personal and professional answers. For me, and I can't speak for everybody, but that professional drive and personal one was to deliver that patient care, to afford an education, experience and background to utilising the key skills to support our patients within a range of deployments and environments. Professionally, we can now align ourselves to what is expected both of the College of Paramedics, the Healthcare and Professions Council, which is our registering body, and also our patient cohort. So they know they are getting a qualified and recognised individual who is able to work within the scope of practice to support their care and needs. They maintain this by undertaking continuous clinical exposure, or CCE, so that they work alongside our civilian counterparts to ensure that experience is maintained. That overlaps into the military environment, so once undertaking all their training, they can deploy and feel that they are almost at their top of their game, ready to deploy and support the requirements of defence. On a professional and also personal, it's all about that development, that standardisation, and from an RAF medic perspective looking forward, there is an alternative path instead of the mainstream of RAF medic and promotion and the multiple roles that holds, but now with a more clinical focused and recognised route.
We talk about recognition. Presumably the skills and the qualifications you're gaining within service with the RAF are transferable at the end of your career to civilian world?
Yes, because it's standardised and is what's expected by our governing bodies. Paramedic title is a recognised title and it's a legally held one. So you need to undertake the training and to be registered with the Healthcare and Professions Council to call yourself a paramedic. So hence why our individuals are skilled and experienced when it comes to that the role, and they hold that requirement on a regular basis to ensure that compliance with that title.
And you spoke a little bit about from personal and professional sides of things. From a personal side, what is it like when you're deployed on an exercise, or more specifically maybe on operations, and you see that patient transfer? Maybe you're going out to something that's happened, and you follow that process through and realise just how much difference you're making.
I think that comes down to the training we undertake, the exposure we maintain to ensure that we are swift and effective with that patient and casualty care. That comes down to being professionals. If our individuals are not maintaining that competence, the effective patient care is drastically affected. We can ultimately delay that or hinder the care if they're not up to date and feeling confident within themselves. And I think when you are confident and you are maintaining your skills, that confidence is shown by competence, and that patient is then supported. And that for me is that feeling of we are delivering that care at the right time, at the right opportunity, to the right person, to the right pathway, and we can get them to where they need to be, from point of wounding to home.
And presumably, Jake, this fits in really neatly with Kaz's ready to fly and fight doctrine, because at the end of the day, somebody deploying knows that the support is there if the worst should happen.
For me, it fits in with that statement. However, most importantly, it's morale. It's morale for the individuals on the ground, knowing that if they are injured or ill, they are going to get the most comprehensive treatment possible by the individuals they're supported with. And I'm very proud to say that each and every one of the paramedics we've got has that desire to provide the top class patient care which they deserve.
I'm sensing, just like when I was chatting with Shai previously, that it goes beyond a profession for you. You're proud of what you do, and rightly so.
I'm proud of the individuals I now get the honour and terror of supporting. I'm proud of the outcome of what they achieve, and that they continue to demonstrate. We're a small speciality within and amongst RAF medics, and I think with that in mind, what our individuals do and how they enhance the patient care is exceptional.
So that's a bit about the team behind this. So around about 50 people involved. What are the opportunities if someone is listening to this currently and is an RAF medic and thinking maybe this could be something of interest? What's their next step, and what are the opportunities? What will it bring to them?
All I can say is do it. It was the best career choice I made, and with having multiple people coming through the training pipeline and getting the experience and exposure, they keep on selling the same point. What they need to do is that we employ normally a set number of individuals per year, which we will then support as the RAF and through as a tri-service approach through university. And that's an application process every year. So at the moment, that's going to be released in the early new year for the next cohort to start in September. With the agreed university, which will undertake then a 2-year training pathway at university to become recognised recognised paramedics and register with the Healthcare and Professions Council. From then, they will go undertake a newly qualified paramedic period, which is 2 years, and that's supported at an ambulance service. So it is a longer pipeline, but they get the recognition, the qualification and the registration to build on the key skills and experience and exposure within the role to make sure they're effective not only to the clinical cases in the NHS but also to our military requirements.
And presumably, because you're doing it via the RAF, you're getting the support, the wider support that maybe if you were doing this as a civilian, as a paramedic student, that you wouldn't necessarily have.
So our students were train alongside, and they are embedded with the civilian counterparts from the university. They take up a number of those positions, and the funding is afforded for them through defence. So, a very well-paid student.
Fabulous stuff. It sounds like a unique opportunity within the services. Jake, thank you very much for taking the time to talk to us today.
Thank you very much. Thanks for your time.
Thanks very much, Warrant Officer Jake Callender. And there are some future developments in the pipeline with the RAF paramedic specialisation, with them separating within the RAF medics to become their own recognised specialisation under the Allied Health Professions Clinical Employment Group. We'll be hearing more about that, hopefully in a future episode of Inside Air.
With Reheat for Inside Air, I'm Corporal Victoria Andrews. Chief of the Air Staff, Air Chief Marshal Harv Smith, has met with his French counterpart to further cooperation between the two forces. The meeting provided a platform to discuss ongoing collaboration, future opportunities and shared challenges, while highlighting their shared commitment to defence and security cooperation. The meeting builds on the foundations of the Lancaster House 2.0 declaration signed earlier this year, which reaffirms the UK and France's commitment to working together to address global security challenges. A 99 Squadron RAF C-17 Globemaster has delivered a critical strategic airlift from RAF Bryce Norton to Nairobi, carrying 9 pallets of essential kit, weaponry and personnel. This operation was executed with the support of logistics movers from one air mobility wing. RAF personnel worked together in direct support of Exercise Haraka Storm, a crucial British Army training exercise which is designed to train and prepare light role battle groups for deployment in demanding and harsh environments. And RAF Bryce Norton has been awarded the Furman Sword of Peace for having been judged to have made the most valuable contribution to humanitarian activities at home or overseas. The sword was awarded for Operation Underhill, which was the RAF's essential contribution to a global humanitarian effort to prevent famine in Gaza through airdrop delivery of aid with the Atlas A400M aircraft. 83 Expeditionary Air Group 206 Squadron, the Joint Air Delivery Transport Evaluation Unit and 47 Air Dispatch Squadron Royal Logistics Corps were at the forefront of activity, demonstrating the RAF's ability to conduct complex airdrop operations under challenging conditions. That's Reheat on Inside Air.
Thanks, Vic. And now it's time to see who's under the hat with Ben.
I'm AS1 Ben Russell, and this is Under the Hat, where we get to know an aviator in less than a minute. Name you're known by.
Hi Ben, I'm Squadron Leader Jim Martin.
What's your profession?
I'm the current OC of 602 City of Glasgow Squadron.
What's the best thing about your job?
Leading our talented reservists, seeing them thrive and achieve more than they thought possible is genuinely rewarding.
Hardest part of your job?
Balancing the wide variety of demands required in managing a reserve squadron. I'd love to support all requests, but it's just not practical.
Best location you've served?
Has to be Norway, when I was a helicopter crewman on the Puma Force. Operating in such spectacular and testing flying conditions brought a great sense of job satisfaction. Learning to snowboard was an added bonus.
What bit of luxury kit do you never deploy without?
My iPod. I love my music, and no matter where I've been deployed or what conditions I found myself operating in, my tunes would always provide a small bit of welcome normality.
And what's your proudest moment in the RAF?
This is very tricky. Picking one moment out of 39 years of service is hard. As the proudest, I would have to say fulfilling the role of Squadron Standard Bearer for 602 Squadron in August 22. Everyone on parade delivered flawlessly, making the whole experience extremely special.
And that's all from Inside Air for 2025. We'll be back in 26, so from myself, Flight Lieutenant Chris Solly, and all the team from 7644 Squadron and all the RAF reservists who produced the podcast, have a great Christmas wherever you are in the world, and here's to 2026. In the meantime, please give us a review, subscribe on your favourite podcast app, and join us again soon for another Inside Air.
You've been listening to Inside Air, a behind-the-wire view of the Royal Air Force, its people, technology and operations. If you're serving in the RAF and have a story for us, please speak to your unit media and communications officer. Inside Air is written and produced for the Royal Air Force by RAF Media Reserves.